This is this will have to do. So, hi Manaswini.
Hi,
It's
Saloni.
meeting you for the first time today. Welcome to the first episode of Nolme Pod, which is a podcast by Nolme Labs, where we talk about pretty much everything from science to mental health. My name is Saloni, and this is Manaswini. So tell us a little bit about yourself, Manaswini.
So, hi everyone. I'm Manaswini. My pronouns are they and them. And I am a counseling psychologist, and more importantly, a queer affirmative counseling psychologist. And we'll hear about why it's important to state that soon. And I'm really excited to be here.
Thank you. So do you want to start us off by telling us, my favorite question is, what got you into psychology?
That's a tough one because the reasons I got into it are probably not the reasons I stayed in it. But I mean, pretty cliched, had my own mental health struggles growing up, and also watched people in my family struggle with mental health issues. And somehow my own mental health issues weren't that much of a motivator, but seeing how some of my family members were treated for struggling with mental illness, the stigma they would face even after they were on treatment and doing better, and just the way people have a lens through which they view you after you have been diagnosed with a mental illness. I think wanting to make that social stigma better is something that got me into psychology. I didn't always want to get into practice. There were a few times where I thought I wanted to get into research, and right now where I'm at is practicing, but also being in the queer rights space.
Right. So with me, I kind of I wanted to do clinical psychology and I really liked the subject and I was good at it. But there was like something in my head that said, that's not all you need to become a good practitioner. You also need to be able to have boundaries, to be dispassionate. Like sometimes you need like an objective lens through which you can look at stuff. And I felt like I didn't have that. So, like, did you have that question?
Um,
So, like, did you ever feel that, there's a soft skill or it's not just the subject, it's not just being good at the subject, but there's something you need um, in terms of like not just a technical skill set, but also how would you deal with the possibility that a client may not be helped or something like that. Like that used to be my concern. My concern was that I'll reach their homes and be like, are you doing better? So did you always know that would be something you would like to take up?
uh, no, I don't think I always knew that I wanted to practice. I think my biggest learning curve happened during my master's when I interned at a rehab center and under a psychiatrist. And I got to interact with clients in my own small way, whatever was, permitted by the psychiatrist, and basic stuff like history taking. And I would also get to sit in on some of the group sessions and stuff like
Yeah.
that when I could. And I think, yes, I think you're right about the part where you can have all the technical expertise and know all the theories like the back of your hand. But if you don't have a knack for understanding people or understanding what they need, sometimes they don't, and actually most times they don't want you to throw big terms at them.
Yeah.
But I think they just want someone to be present with them and, you know, see the world in their shoes, I guess.
Right. So you are trained in queer affirmative counseling.
Yes.
Could you tell us then who is queer? Why do we use the term queer?
Okay, so queer refers to anybody who has a sexual orientation, gender identity, gender expression, which is not normative. Now, what is normative? Normative refers to something that is determined by social norms. This can be as simple as you walk into a college and you see all the women there wearing, salwar kurtas, and that's the norm over there, that they dress in salwar kurtas, and that is what they expect everyone else to do as well. The same way society has certain norms for sexual orientation or sexual behavior, that men can only marry women, and you know kids must be had within the context of that marriage, and you raise your kids based on the sex that they are born. So people may have gendered expectations growing up for when they raise a boy versus when they raise a girl, and set those on them. So though all of those are norms, they did not always exist, which is the most important part to remember. But they've been so ingrained into our society, and the people who run important, systems in society like healthcare, legal systems, laws, all of those are run by people with those similar biases and norms that have been ingrained into them. So which is why we call this a heteronormative society. So anyone who is not accepted technically under the heteronormative society would be considered queer. So that would include the entire spectrum of the LGBTQ community.
Right. And is it offensive to use the word queer?
It used to be used as a slur to, it was a derogatory term used for people with non-normative sexualities and gender identities. But now the term has been reclaimed by queer people themselves, and it is now okay to use queer as an umbrella term for non-normative. So GSC.
Right. You mentioned that in terms of systems, we have the education system, we have the legal system, the healthcare system, that is very heteronormative. So in what ways is it heteronormative, and how does that impact people who identify as queer?
Mhm. So for example, I'm going to continue with the example of uniforms that you have in
Yeah,
educational institutions, where if you're male, you're supposed to wear a shirt and pants, and if you're female, you're supposed to wear a skirt or pinafore or whatever. So it's all divided into two categories, like you either dress like a boy or you either dress like a girl, and none of these two categories are allowed to switch. Like if a
right,
boy wanted to wear a skirt or if a girl wanted to wear those pants, uh, that might not be allowed in every institution. Some might allow it or make an exception for people, but most are not that understanding. So um, the same way, all of the systems kind of divide gender into binaries and do not consider that the sex that someone is assigned at birth may not always align with the person's sense of gender identity or how they identify. Like you categorize someone as male or female, but has anyone asked them what they identify as? Um, in the same way, even with office forms or even in healthcare setups, you might find gender male, female, and that's it, and it's usually conflated with sex. So they don't even have the understanding that gender and sex are two separate concepts.
right. And they're both on a spectrum.
Yeah.
Right. So they may interact, your sexual identity or your how you see yourself might interact, but they may also not have anything to do with each other. Um, in what ways has psychology, so psychology also would be a subset of a system as a discipline. It has been very heteronormative. What has been the interaction of psychology as a discipline or a profession with queer people?
Mhm. So for a long time in the DSM, Do I need to explain what DSM is?
You can.
Okay, the
Yeah,
classification system for mental illnesses, which is adopted in psychology. Uh, Homosexuality was listed as a mental illness, and it was fully declassified only in 1980, but there has been a rocky history with that. It was actually declassified earlier than that, but they reclassified it as a mental illness uh, by saying that there is something called ego dystonic homosexuality, which basically means that a person who is gay but does not want to be gay. And the reason they did this is to justify conversion efforts, which is efforts to change a person's sexual orientation or expression. Um, but the issue with that is no one ever asked the question why the person does not want to be gay, and is there something wrong with the person's circumstances or the environment they live in, how they are treated? Does that contribute to the desire not to be gay? Because the whole time it was seen as an internal thing, like your sexual orientation, gender identity, whatever distress that brings you, it was seen as coming from you. Like you're gay, that's why you're upset about it. But what are the things in that person's life that are not allowing them to be the way they are? And
yeah,
yeah, causing that distress. Like the source of distress was always seen as internal and not
correct.
external.
I think that's even true for a lot of mental illnesses. Like even distress today, there's not a very holistic view of where the distress is sourced from. It's not biological. It's the interaction of everything. So I'm just gonna skip a few questions because we've touched upon it already. But what are some queerphobic things that maybe psychologists do, or within a therapeutic practice, what would be something that would harm a queer client?
I think, first of all, not using that person's chosen name and pronouns and instead going by their legal name. And this is especially applicable for trans folks seeking therapy, because the process of changing your name and gender markers on legal documents is honestly a long one. It's also hazy because of
Yeah,
the new laws and policies that have come into place. So not everyone has their documents sorted out yet. But does that mean that you don't affirm who they are? So, that can be one, and not using their pronouns, because that can definitely contribute to their dysphoria, if not cause it. Uh, Another thing that they might do, which is more subtle, uh, but sort of, you know, uh, attribute their distress to their queerness
right.
rather than seeing the context around it. Um, or maybe even assuming that a queer person is coming into therapy because they're upset that they're queer, or because they're having an
That they're
identity.
looking for reparative efforts.
Yeah.
Hmm. um so to be clear, then engaging or entertaining the notion that you can, as a therapist, cure homosexuality is illegal, but there are still practitioners who claim, and they charge a lot of money, like the recent news report that I saw, which was a psychiatrist in Delhi who was charging 1.5 lakhs to
Mhm.
kind of to sell the notion that there is a treatment for homosexuality. There's a lot of things wrong with that, so let's kind of dismantle everything that's wrong with that. You go first.
I think the reason that so many people might actually buy into that kind of uh, effort, I mean, legalities aside, is, as I said, it is scary to be queer in a
Yeah,
heteronormative world. And I think that leads to a lot of desperation. I think ultimately the decision to enroll yourself or enroll your child or family member into a conversion effort is it comes from desperation and fear that the person won't be accepted in society, or that their life is going to be, 10 times more difficult now that they're queer. But that, and you kind of hold on to any hope that things can change, but it's important to understand that it's not you who has to change, but it's the norms. And just
Yeah.
understanding that these rules that people have set for sexuality, gender expression are changeable, like, and they have been being changed and challenged for centuries now.
Yeah, much easier to change the norms than it is that's something that is not changeable.
Yeah.
Um, and also doesn't require change. So what's ironic is that it may even come from a good place. It may come
Hmm.
from a place of concern,
Hmm.
but that very dysfunctional concern is causing the distress that has sometimes led to a lot of dire outcomes for people who were subjected to reparative efforts. Um,
And
yeah,
even when there is that fear that, you know, uh, how is my kid going to be treated outside? Inflicting more violence on them is, spoiler alert, not the answer.
right.
Uh, if you are really that worried about your kid not being treated well in the outside world, I mean, you can't change what's outside, but you can control what's inside your home and how you react to it.
Yeah. Another problem with the whole conversion therapy is that um, it's sort of capitalizing on the, I mean, it is then a practitioner capitalizing on a lack of understanding as well as the stigma of, being from a marginalized sexual identity.
Mhm.
So not only are you pitching something that's impossible, not only are you feeding false hope to families that come to you thinking you're the expert, but you're also making a lot of money out of it. You're making money out of something that shouldn't exist, and that is, like you said, it's inflicting violence on the person who, for the most part, is often an unwilling participant.
Yeah.
It's very like the instances that we talked about,
Hmm.
where we talked about ego dystonic
Hmm.
efforts, that's still a minority of
Yeah.
the cases. Most people don't really want their sexualities altered. They would
Hmm.
like to live happier lives though. So,
Yeah.
right. Um, I think another aspect of conversion therapy, like we all know, I guess even in the psychology field, we know then that, or maybe most of us know then that conversion therapy is wrong, it's illegal, you shouldn't do it, but we don't really know what it entails.
Hmm.
And I think if we knew what it entailed, then not just the principle of it being wrong, but the morals and the ethics of it would be subject to more scrutiny. So let's talk about what happens in conversion therapy. So yeah, go ahead.
So I think there are many different methods applied by these so-called conversion therapy practitioners. I mean, hormone replacement is one, and it comes from the misconception that if you're gay, or you are trans, that sort of comes from an imbalance within you organically. Um, and I still see those misconceptions floating around that, gay men can't have kids when actually they can and do a lot of times. Uh,
They think gay men can't,
can't have, yeah,
so
can't
their sperm
have.
don't
Yeah,
lead
that's
to
a
children.
common misconception that I've seen.
Okay.
Or that like lesbians have more of testosterone, the male hormone. So I don't know, there is a prevalent misconception that hormonal imbalance kind of determines whether you're gay or trans or queer, etc. So hormone replacement is one form of
I
conversion.
mean, what's interesting is that is a prime example of conflating gender and sex. Like
Yeah.
that is one of those sexual identities. We think
Hmm.
um, that if we if we change all your hormones, we're gonna fix your sexual orientation. So yeah, that is one big example of yeah, not just gender being shown as binary and but
Mm.
also that it's yeah, changeable.
Mm-hmm.
Yeah,
Yeah,
what else
this
about?
there's also lobotomies where you cut off a portion of the frontal lobe of your brain. Um, and bicycle riding as like a form of punishment for being gay. A lot of these punishments actually included either physically tiring you out or making you read a lot of religious material, or depending on the approach, I guess. So you might have to read religious texts continuously or watch videos related to that.
Hmm.
So that was another form of
I
being.
think with the whole lobotomy and also the bicycle riding, the idea was to make the person less responsive at all.
Mhm.
So yeah, even with lobotomies, um, similar to how they used to treat mental illnesses, is if that person is no longer able to behaviorally present what they would call symptoms of whatever condition they were going through, it's assumed that a cure has happened. But actually, that person hasn't changed.
Mhm.
They are just unable to now express themselves.
Mhm.
So you've kind of made them made them immobile in a way.
Yeah.
And
Think
I think,
that's how a
yeah,
lot of medications worked at that time as well, not
yeah,
just for conversion therapy, but also mental illness in general.
depression and
They were
yeah,
just,
mood disorders.
yeah, more intense sedatives, which would kind of keep that person, make them stay put.
Yeah, I think for symptom management and stuff like that.
Mhm.
Um, Another thing with conversion therapy is that a lot of the individual therapies under that are they were part of aversion therapies, and aversion therapies function by the logic that if you, I mean, based on conditioning, that if you pair a behavior or a symptom with something aversive, like an electric shock or inducing vomit, then it's going to eventually lead to an extinction of the presenting behavior. And again, this all these therapies may be legit in their own right because they work for alcohol addiction, they work for nicotine addiction, but then it begs the question that you're misapplying a legitimate therapy in a context where it's not needed, to misdirect from, like the notion that this is not something that needs a cure.
Mhm.
It needs more understanding people around. So it may not all be non-science or pseudoscience. It could just be an unethical application of an otherwise legit science. So a lot of it kind of boils down to the decision making of the expert. So I think that's a good place for us to talk about. I mean, why is it harmful to be subjected to conversion therapy? In what ways is it harmful?
I mean, the obvious ones are it can lead to a lot of mental distress and trauma. And the fact is that they don't work, and they
Yeah,
never. And so even if you go in with the expectation that something might change, it's not going to, because nothing is wrong. Like, you can
right.
fix something if it was broken, but it's not.
It's not broken. Right. Um, in other ways, a lot of the times, conversion therapy is something that, like you had said, is forced upon by the parents because they want a good life for the kid, for their kid.
Yeah.
And then it also kind of becomes like it's much harder then to
Mhm.
resist an effort that is being made by your family. Like if somebody else was doing it, then maybe it becomes easier to file a case. It becomes easier to, go to the police, file an FIR. But when it's your own family that's doing this, and sometimes it's your own family that you're dependent on, both financially
Mhm.
for shelter, resources, and also emotionally, obviously. So I think that can be a very invalidating experience. Yeah, go ahead if you wanna say something.
Okay. Uh, yeah, yeah.
Sorry, I thought you were saying something.
No, I
Oh, okay.
wasn't. I was.
Okay. So I read this, like the most recent case of conversion therapy actually causing harm was in May 2020. I'm sure there's many more, but this is the one that was reported. In May 2021, which is literally 1 year ago. So it's not like it's a very outdated practice and you don't find it. It is very prevalent. But Anjana Harish died by suicide, and she left a video saying that the reason for her suicide was that she was being forced into conversion therapy by her family. Um, Again, it is illegal. The UN has already established, all major psychological societies have kind of given out statements that this is a non-science, this is a pseudoscience. Not only is it ineffective, it's also immoral and unethical to do it. Mental illnesses, homosexuality or queer sexualities are not mental illnesses at all. But it's still pretty prevalent. So what do you think psychologists can do to kind of, what can they do in the face of these if they know somebody who's practicing conversion therapy, or if they have a client who says that they would like to give it a shot because they might have a shot at a better life, then what should be the stance of a psychologist there?
Yeah, I think a psychologist should fully take the responsibility to be against conversion therapy, voice the same. And if someone does approach them hoping to get conversion therapy services from them, uh, to educate that person about the fact that this is not only unscientific, but it is a form of violence, which has been acknowledged by the Indian Psychiatric Association, as well as more recently the National Medical Council, which now allows people to take action if they find doctors or medical practitioners or healthcare professionals in general practicing conversion efforts on queer individuals.
Right. I want to talk a little bit about, even outside of conversion therapy, there is the possibility that a therapist who is otherwise extremely qualified, very well trained, perhaps with many years of experience, may still not be the right therapist
Mhm.
for a queer individual. So, what is it about a queer affirmative therapist that is providing something that an otherwise neutral therapist is not providing?
I think there are many excellent therapists who are masters in whatever modality that they use. But I think there's a gap in the training of therapists in the first place, being queer affirmative, uh, learning about the politics that go into mental health, people's mental health experience, access to treatment, etc. That's not exactly something that's explicitly told to us when we any of us are learning psychology. And I think sadly being a queer affirmative therapist kind of requires effort and internal work on your end. It not only requires you educating yourself on political structures and socio-political contexts that affects people's experience of mental health and mental illness, but it also requires internal work about your own biases, like where does your social location imply about you, and the way you've been sort of trained to think, what privileges do you have and don't have that affect your view of the world, of other realities. So I think in this day and age, you can be a really well qualified, trained therapist and doing excellent work for years together. But if you haven't done the internal work of being queer affirmative, or even wanting to continue education to train as a queer affirmative practitioner, I don't think it makes sense at all.
What do you mean by internal work? Can you like give us an example?
I think for me personally, if I had to speak about my experiences, uh, I I think I had very distorted views myself about what queerness is and about what queer people are, which is ironic because I am queer. But I think I still held many biases based on the way that I was raised. Uh, like, for example, I didn't entirely understand the trans experience when I was growing up, because you are fed so many myths when you're a kid about trans people, especially trans women. And I think for many people, trans women are the first point of contact with anything queer in your
Yeah.
life. Like when you ask someone when is the first time you saw someone from the LGBTQ community, it's going
Yeah.
to be trans women. Uh, so the myths that you're fed that uh, about their bodies, about them being able to curse you or bless you, and
Yeah.
just like a general mystification of queerness, along with discriminating against them and still making it seem like they're not part of us, like there's male, female, and there's trans
Yeah.
people. So I think that was a bias that I was definitely strongly raised with, although I never acted on it or discriminated against anyone who was trans, but it took me a while to uh, learn the difference between sex and gender in the first place, which is something I had to look up on my own
Right.
to know that that is not the same thing.
Yeah. So in terms of like, seems to me that there's a lot of unlearning that needs to happen,
Yeah.
not only by a cishet therapist, but probably a little bit more than a cishet therapist, because there's fewer challenges
Yeah.
in their existence, even as human beings, that might force them to rethink their notions of sex, gender, and people from other sexualities. Mm, so, can you tell me a little bit about perhaps why would you prefer a queer affirmative therapist over a neutral therapist? Or let me rephrase that. Um, what would a queer affirmative therapist do differently than a
Mhm.
neutral therapist in their practice? How would the experience differ for a client?
Mhm. I think a queer affirmative therapist would kind of acknowledge the struggles that queer people have to go through, which uh, you know straight people or cishet people do not need to go through. Like, for example, having to come out if that's what they
Right.
choose. Like, having to come out is not a struggle for cishet people in the first place, because their sexuality or their gender identity expression is accepted widely. But having to hide that one part of yourself and move through the world and be watch for where you can say it, where you can't, that's something that queer people have to face. So struggles like that, or even with trans people, feeling gender dysphoria, that's something that cis people do not need to face, because their assigned sex at birth matches who they identify as, and you know all's good in the hood. I'm sorry,
Yeah.
that was I'm sorry. I
Yeah.
regretted it as soon as it came out. But anyway,
I was like, did I miss did I miss this part of the question? Yeah.
but anyway, yeah. So someone who understands uh, the struggles that queerness and being queer in a heteronormative world, the challenges that poses, which maybe cishet people just take for granted. Being able to choose a partner that you can get married to and see a future with, without anyone stopping you from doing that legally. um, Having socially sanctioned relationships, being able to express yourself as the gender you are, and without getting stared at or mocked or questioned about why you
Or
express
bullied.
yourself in a certain way.
Yeah.
Yeah.
Right. So that kind of reminds me that um like this is something we talked about during developing the course and stuff. But all the milestones that we think of as important in our lives are also very heteronormative. Like marriage will happen, child will happen, you'll make your
Yeah.
parents grandparents, and all of those pressures
Mm-hmm.
that are there. They're pressures perhaps for everyone, unless someone's really enthusiastic
Mm-hmm.
about accomplishing those things. But it must be so difficult to be closeted and then, I mean, navigate those conversations. It's difficult enough as it is, but then to sort of, the urge to correct or to say that this is not important um to me, or this may not happen and I'm okay with that. Um,
Yeah, and
yeah,
queer time is definitely a thing. I think cishet people have all these milestones that they achieve by a certain point, roughly. I mean,
yeah,
2, 3 years, give or take, that you, I don't know, you have your first relationship at a certain age, you become sexually active by a certain age, you get married, kids, etc. Uh, and they have these markers for when a relationship might be serious. For example, if you tell your
yeah,
parents about it, your relationship is serious. But does a queer person have that option in a way, in a world where there is so much violence against
yeah,
queer people, and it's very much a safety hazard to come out?
yeah. That's true. And that kind of brings me to the next question, that even for a person, for a cishet person accessing therapy is such a, I mean, I won't say it's nascent, we're still getting there. We're still getting to talking about going to therapy openly. We're still getting to admitting that maybe we need help, but it's still a very stigmatized space, and it's also very unregulated. Which means that if there are unethical practices, then there's no really regulated, no formulated grievance redressal process. You literally have to lawyer up and fight for yourself, which a lot of people may not think is worth the effort. They might think it's more practical to change practitioners, or to perhaps at worst leave a bad review, maybe. But the consequences of an unethical practitioner for a queer client is that much harder, because they might be closeted. Every aspect of their life could be affected by, say, a breach of confidentiality. Like there was a case that we've mentioned before while discussing the course. There was a psychiatrist in Delhi who, I think, had a client who was a 17-year-old, so also a minor boy who was not out to his parents yet. And the practitioner, even though, I mean, in this case, he didn't recommend conversion therapy, none of that, but he did violate confidentiality and talk to the parents of the child. And even though this same non-ethics can happen to a cishet person,
Yeah,
um, the consequences are much worse for a queer client, which kind of makes it that much more important that practitioners, whether they are um, otherwise well trained, highly qualified, have great reviews, should also go into understanding the consequences of their, not just non-ethic, no one should be unethical, but into every aspect of their practice. So I wanted to kind of ask you, can you give some other maybe examples of how the same non-ethics could apply differently in a queer context, or its significance could be contextualized differently?
I think, for example, uh, there's the one of non-maleficence, or not doing harm to your client,
Right.
which of course you obviously can do to a cis and heterosexual client as well. But maybe a way in which that could happen to queer folks is if a psychologist constantly implies that, you know, being straight would be easier, or pushing them towards just,
Yeah.
okay, your identity is a phase, or you'll get over it. Why don't you try going out with someone of the other sex? And so maybe
Yeah.
pushing them towards trying to change themselves for the worse, rather than coming to terms with it, and finding ways to live their authentic selves. Uh,
Right.
with,
So coming from a place of ignorance and accidentally then
mm,
dismissing or
yeah.
trivializing,
Mhm.
um, right. That actually does remind me, like I knew of this case
Mm.
where somebody was, again, I guess this is one way to neutralize that somebody's problems do not stem from their queer identity. So just saying no, depression is depression, and the
Mm.
solution to it is the same, the treatment to it is the same. But
Yeah.
it's really not, because depression is not just genetic or biological, it has a social component, and that social component can be where all the triggers are. So if you
Yeah.
do have greater triggers in your life of a certain personal nature and you're closeted and things like that, it could aggravate. So I
Mhm.
feel like that's the sort of heteronormative bias that a therapist who is untrained in QACP um, might exhibit.
Mm.
Um, what sorts of biases do neutral or untrained therapists come with?
Uh, I think a neutral or untrained therapist can be unhelpful at best and harmful at worst, where even if they don't explicitly state that they're against someone being queer, they might have a very nonchalant approach about a person's queer identity, even though that is something which is important to them, like central to them, and
Yeah.
affects the way they move through life. So I think there's like a fine line between overdoing it, where attributing everything to that person's queer identity and then kind of ignoring it as an aspect of them that doesn't exist. And something that I've noticed, like just not even in therapy, but like outside the therapy context as well, is how we look at queer relationships. Like when I first started, when I first came out to my friends, and told them that I was seeing someone, uh, their enthusiasm might not have been the same as if it were a boy. You know what I mean? Like they would not show the same interest in
It
it.
still wasn't quote unquote normal, the degree of
Yeah, like they wouldn't say
enthusiasm.
anything bad, but it was
Yeah.
just like a thing in the corner of the room that we don't go there, can of worms. So
Okay.
even really dodging a certain subject related to
Yeah.
queerness within therapy, like clients notice that.
Yeah.
And
I think also, I guess within a certain framework of politics,
mm,
there can also be the aspect of objectifying every aspect of a queer person's life as
mm,
being political. So we'll see this a lot in when we critique Bollywood movies.
mhm,
So many of them have been of a progressive politics and all of that. And then we'll overthink, but why did they? Like, this is a conversation we've literally had
mm,
in our department, in our group, um, where in Gili Pucci, we were kind of debating whether it was a good thing that the director chose to represent a butch femme dichotomy, or
mm,
is that stereotypical? Is it again going to lead to consequences of portraying a limited imagination of what lesbians are like? Is that limiting? um, so again, I think just the fact that it's possible that there are relationships out there like this, and it may not mean anything political, it may not have a stance or it may not be a point of advocacy at all. So I guess those conversations also point that this is not yet normalized, because it's still something that is very salient and noticeable. Is that what you meant, like when
mhm.
your friends, I'm guessing, over celebrated?
Yeah, yeah, basically, yeah, that. And then I think another stereotype or bias that maybe therapists might hold is not one thing in particular, but just applying like a heteronormative lens while you're
Yeah.
looking at a queer client. Like if someone is talking about their relationship, are you gonna internally classify them as man, woman, and do they want
Hmm.
marriage and do they want kids, and like what is the longevity of this?
Yeah. Yeah.
Or maybe seeing a person questioning their identity as a phase, or them being confused, or just like a transitioning feel. Like why do people see questioning identities as like a transition phase. Like you're not there yet. You're questioning, and then at the end of that questioning, you're gonna have to decide, like pick one of
Choose.
the labels.
Yeah.
But being questioning can definitely just be a valid identity that you have for however long you want to do that. Like it doesn't always have to mean uh, uncertain, or it doesn't have to be turbulent. You can be questioning and you can still have very fulfilling relationships and intimacies and be quite happy and authentic in that quest.
Right. Right. So the reason we did this podcast, other than of course because the topic itself is important, and this is a very, very abridged version of a conversation that I feel should have a part two or something. But the reason we're having this conversation is because we have been working on a course for Nolme Labs, where we talk about how what ethics looks like in a queer context, or the name of this podcast, how can we queer therapy in an ethical way. So again, it's not a course that teaches counseling. For that you have established courses like MHI's queer affirmative counseling practice um, training. But from dismantling everything that comes under ethics and how that can be recontextualized for a queer context is a course that we've been working on, where you are also facilitator. Do you want to tell us anything about that?
About the course.
Yeah.
So, so it covers your basics of gender, sex, and sexuality to some extent, but more importantly, looks at uh, ethical violations. I mean, I'm sure anyone who's done psychology would have an idea of ethical guidelines such as that by APA, but how does that pan out in a queer context? And actually seeing those things in applications just rather than reading them in theory.
Right. So the idea behind the course was that the training, even the formal education training, firstly does not account for people's politics. And I feel like that's important to do. Like you can't have a formal training that is removed or isolated, or um, it's an insulated topic that doesn't interact at all with topics of caste or intersectionality or religion. There's also, like you said, an introduction into what is gender, what is sexual identity, is it binary or is it on a spectrum, what does that look like, what has been psychology's sort of treatment of these topics over time. And then we get into the ethics of counseling, and then also from a very application based perspective, how do you identify ethical violations, how do you kind of address them, what are the consequences of these non-ethics. So kind of also to stoke the imagination in terms of what is the potential for harm, and can you do a risk assessment of what your recommendation would be if it did not go well. So the idea was to have a course that embodies ethics, because ethics seems to be one of those the stepchild of all topics in psychology that everyone gives for 10 marks total, and then it never turns up again. But it seems to be the need of the hour, especially for a very important topic. Um, which is also because it's a smaller subset, it's a smaller module of a larger ethics and counseling practice course that we're coming up with. So again, this is just a tiny effort um, in that direction. I actually kind of want to ask you now, do you think this is, I'm going to cut this and put this earlier somewhere, but do you think therapists should be political?
Absolutely, yes. I think voicing your political stance on something, it's not just about what party you're supporting or what opinions you have on a current issue, but it very much is about human rights, and whether you acknowledge that not everyone is given the same opportunities right off the bat. Like, where, I mean, there's this lovely video about equity, I think, where there's like a race happening, and a few people are already given a head start, and
Yeah.
a few people are behind. And so to catch up is hard. So when you do not have that head start in life from the beginning, how does your life pan out? So I think acknowledging, where you may be privileged, where you may not be privileged, or where other people may be privileged or not privileged, uh, is important when you're looking at the issues that they're going through or what they're approaching you with.
Yeah. Or even in the interest of transparency, like you may or may not choose to change your politics. But I think it's an important feed into clients deciding whether you're the right person for them. Like there's so much about therapy that has nothing to do. There's so much about the efficacy of therapy working that has nothing to do with training or knowledge or information. It has to do with two people being the right fit for each other. So I think in that situation, if you're asked about your politics, it's best not to adhere to an apolitical or a neutral stance. You might as well acknowledge where, I mean, like they say, right? Personal is political, it pervades every aspect of your life. So your politics kind of will influence the perspectives you bring into the therapeutic space. I'm starting to sound like a hack because zero therapy background. Thank you for doing this. This was great. We've made excellent time, which is not bad. It's kind of
Thanks.
a first.
Thanks for having me.
Thank you.